just few words to introduce my organization. I'm from Monasterio Foundation, which is a group of public research hospitals, tertiary center for cardiopulmonary diseases, and we are one of the pilot sites for xShare and an early adopter of the xShare button. We work with the standards and EHR system since early 2000, late 90s. And we always wanted to give our patients something more than paper, but to support their healthcare processes, and also to support encounters with other healthcare professionals and general practitioners. So that's why we are really interested, and we started adopting the xShare button directly in our system. We have something that can be easily accessed, let me say, by the patients, because we have a portal and an app that can be used by a normal PC, so the patient can prefer sometimes to use the PC instead of a smartphone, or the smartphone directly, because it's much more comfortable, of course, to bring data around and have data in the smartphone. You can find on the right-hand side of this slide the discharge summary and laboratory report and patient summary and discharge report again, that has on its side each report the xShare button. So you can choose which repo you want to download, because this is the first function that we implemented. And just clicking on the button that you want, you can pick the local or the position that you want to use for the download, and have the file that is the structure format that Evangelos just mentioned to be used for anything that you want. So you are really in control of that. And this is perhaps too technical, but just to show that we are not talking about paper. We are talking about data that can be processed between different servers or computers, of course, and you can just have the sense here of the patient name. So we are talking about of Marina, and we are talking about a condition that affects Marina, and that, for example, brought Marina to our hospital for an investigation. And after the investigation, or included in the investigation, we might have some kind of merging of the information that were available for Marina, usually contained in the hospital EHR, with information that are coming from the EHRxF, from the format. So here you can see, this is in Italian, but this is the list of conditions that affects Marina as detected by the physicians. And this is something that might be easily translated, as we will see later. Again, we might have also the report, the single report that we're generating in the hospital, and this is something that we might insert directly in the discharge summary. This is the initial point, the structure format. Again, we might have a secondary usage of Marina, and that is, I skipped just one. And that is the download of the document, because this is the current functionality of the system. And in the document, that is, of course, an electronic document that is internally structured, but not structured as a list of distinct information. The document has an attachment inside. So you have the document downloaded, and within the document you have the structure format of all the information that you can give to other healthcare professionals to take care of Marina or of yourself. But this is something that can also be associated to a QR code. We talk about the QR code in the beginning. And this is a really basic implementation to let you try this. Please take a picture of that QR code now, and you should find a structure file that is technically called JSON file that reports all the structural information that we have behind the document that we are just visualizing. So this is the first usage that is capable to merge the documental part that might be necessary for certain processes with the structure part that can be used later or at the moment also to support other investigation or patient continuity of care. You can check also a visualizer of the same information. This is another example. This, if you take a picture of this QR code, you can open a visualizer of the more or less the same information. This is just an example to show that you don't need, of course, to understand the structure format of EHRxF. You don't need to know something about HL7 but you can use some external program or internal program within the same platform to show the information. And what you can find there is that the condition that affected Marina is translated, for example, in English. That's because we have some coding system behind the structure report, behind the hospital discharge report. So we are capable to do what Evangelos just mentioned, but on the other way around. So starting from Italian, have some translation in English or any other language that can be supported by the dictionary. So to see some live action, this is a video. The patient app is directly available from our patient portal, or you have already installed in your smartphone. You can access using an authentication code. So you need to insert here your identification code for the single patient. And you have associated a phone number here that is receiving an OTP, a single key. And this is our patient portal main menu. If I click on the PDF of the discharge summary, which is the first line, you can download the report and you can read the report and show the report to somebody else. Here you have all the laboratory information, the instrumental examination, and also the discharge therapy that can, of course, be prescribed. Here you have the two QR codes that you can use just to send to somebody in front of you also the structured data to be imported in another system. But you can download only if you want the discharge report in a structured format. So this is, of course, not for patient, but just to exchange information between computers, and you can have this file locally on your PC or on your smartphone. And the same thing applies for example, outpatient laboratory report or inpatient laboratory report that is embedded within the patient summary. And here we have an example of the patient summary itself that represents essentially your clinical status. So the most important information that the physician needs to know before taking care of you, your allergies, your current medication, is included here. So this is a first example on how the information can be really used in a hospital and can be really exchanged for clinical care.